The decline of autophagy with age not only accelerates tissue degeneration but also heightens vulnerability to cancer. Yet this very relationship between autophagic function and malignancy offers a strategic opening: the potential to use autophagy-related biomarkers as early indicators of cancer risk, especially in elderly populations. As cancer incidence rises with age and early detection remains critical for survival, identifying molecular footprints of autophagy dysfunction could transform how we approach screening, prevention, and personalized care in aging individuals. Autophagy is a tightly regulated, multi-step process involving initiation, vesicle formation, lysosomal fusion, and degradation. Each phase leaves measurable molecular traces, many of which can be quantified in blood, tissue, or imaging studies. Proteins such as LC3-2, microtubule-associated protein 1 light chain 3, Beclin 1, P62/SQSDM1, ATG5, and ULK1 are among the most studied autophagy-related markers. In healthy cells, these markers show dynamic expression patterns depending on cellular stress and autophagic flux. In aging tissues, however, a characteristic signature often emerges: reduced LC3-2 turnover, accumulation of P62, and downregulation of Beclin 1, suggesting impaired autophagy and a cellular environment prone to damage accumulation and tumorigenesis. In cancer biology, these same markers have a dual interpretive value. For instance, low Beclin 1 expression has been observed in breast, prostate, and ovarian cancers and is associated with worse outcomes, likely reflecting a failure in tumor suppression. Conversely, in some aggressive tumors, autophagy markers may be elevated, reflecting the tumor's hijacking of autophagy for survival. This variability complicates interpretation, but it also provides a powerful diagnostic window if contextualized properly. By tracking changes in autophagy-related markers over time, especially in high-risk or elderly individuals, clinicians may be able to detect abnormal patterns that precede visible tumor formation or clinical symptoms. The value of autophagy biomarkers in the elderly lies not just in detecting existing cancer, but in identifying individuals whose autophagic function is declining in a way that elevates cancer risk. Chronic elevation of P62, for example, suggests defective cargo clearance and persistent oxidative stress, a condition linked to both senescence and oncogenesis. Similarly, shifts in LC3-2/LC3I ratios can indicate disruptions in autophagic flux, especially when correlated with changes in mitochondrial or lysosomal integrity. These patterns, when measured longitudinally, may serve as early warning signals, flagging cells that are teetering between adaptation and transformation. Incorporating such biomarkers into routine geriatric screenings would require careful standardization. Aging itself naturally alters autophagic profiles, and distinguishing between normal senescence-related decline and pathological shifts remains challenging. However, emerging technologies such as liquid biopsies, multiplex proteomics, and single-cell RNA sequencing are improving our ability to track these subtle changes with greater resolution. Moreover, combining autophagy markers with other aging-related indicators, like telomere length, inflammatory cytokines, and DNA damage signatures, could enhance predictive power and help stratify elderly patients by cancer risk more precisely than traditional methods alone. There are also broader implications for treatment planning. An older patient showing signs of autophagy failure might be less able to respond to certain therapies or more susceptible to toxicity from interventions that rely on intact autophagic machinery. Conversely, in cancers where autophagy supports resistance, elevated autophagy markers might suggest a rationale for combining standard chemotherapy with autophagy inhibitors to improve efficacy. Yet this promising field comes with cautions. Autophagy is not uniformly beneficial or harmful. It is context-dependent, varying by tissue type, cancer stage, and individual biology. Biomarker interpretation must account for this complexity to avoid overdiagnosis or inappropriate treatment. Moreover, most current markers provide snapshots, not continuous readouts, making real-time assessment difficult without more advanced longitudinal monitoring tools. Still, the potential is undeniable. Autophagy-related biomarkers offer a biologically meaningful, mechanistically grounded way to assess cellular health, resilience, and transformation risk, particularly in the elderly, where subtle declines can have outsized consequences. By shifting focus from late-stage intervention to early functional tracking, Medicine may be able to anticipate cancer before it manifests and tailor strategies that extend not just lifespan, but healthy years lived. Autophagy, once seen purely as a cleanup mechanism, may become a sentinel for the hidden transitions between aging and disease.